Good morning. This is your SmarterHeart University, the physician friend and the patient advocate for better understanding of all things heart-related. I'm your host, Dr. Scott, along with my cardiology partner in crime and my co-host today, Dr. Robert Kaiser. Morning, Bob.
Morning, Scott.
Some weekly housekeeping. We'd like you to tune in to www.smarterheartuniversity.com. That's our website location to listen to previous shows and set up for regular email. We'll be blogging from there on a regular basis shortly. You can go to our Facebook site for daily heart updates that come in every single second. There's some medical news that we like to keep you informed about, and also to answer your questions. Also, www.changeofheartcardiology.com about our practice, all about our fundamentals. Well, this morning, friends, is an emotional one for us. We want to get to the real deal of diagnosing heart disease and heart attacks. So, if you want me to read a textbook, or suggest you to go to a website of describing what happens when you're having a heart attack with the chest pain and all of those different symptoms and signs and symptoms of what to look for. Well, you came to the wrong place. We're going to get to all the things you need to know, but were never informed about. So let's get to it. If you or someone you know has a story to tell, please call us. 866-970-9622. 866-970-9622. Share with us your good stories. Share with us your bad ones. We'll try to take as many calls as we can today. We have a lot to talk about. When we talk about heart attacks, there's 4 things I want you to take away from today. If there's nothing else we teach you, it's this. Number 1, you need to evaluate your risk. Number 2, once you have evaluated that risk, you need to aggressively follow up with your doctor and do what he or she recommends. Number 3, you need to recognize the symptoms. And this may be the most important thing of all of the 4. And finally, once you have evaluated your risk and you're following up, what can you do? You need to know what you can do to treat and prevent the event from ever occurring. I say at the end of every show, say it to all my patients, get to it before it gets to you. So let's discuss point 1. If you don't know your risk, how can you protect yourself? 2 years ago, SmarterHeart University was just a sheet of paper that we used to hand out to our patients, the 5 things you think you know about heart disease, but we're dead wrong about. No one's ever put it out quite before, so I'm told. They are, number 1, EKGs can be normal and all your arteries can be blocked. It can be an awful EKG and you can be completely fine. Number 2, your total and your bad cholesterol can be normal up to 50% of the time and you can still have a stroke or a heart attack. Number 3, nuclear stress tests. And Bob's going to talk about that at one point. Miss 20% of men, 30% of women, either it's bad and you have completely normal arteries, or it's perfect and all your arteries are blocked. Number 4, men and women, as I say all the time, aren't just from Mars and Venus. They're from different universes altogether. How men and women present and form blockages is completely different. And lastly, number 5, even if you think you have no risk, no family history, no diabetes, high blood pressure, smoking, cholesterol, there's a lot you just don't know that's going on inside your body. Unless you go see somebody and get checked, you can check out. End of story. So, Bob, we had a case together that puts this whole case, point 1, in perspective. We had a 44-year-old teacher, mom of 4, athlete, played in a basketball league. She was dizzy for 4 days and didn't seek any medical attention. Didn't think there was anything wrong. She played basketball and she passed out completely. Again, she came to, didn't even go to the hospital. 4 days later, she awoke and came to the emergency room with a massive heart attack. We both tag teamed her. I put in a circulation device to try to get blood pumping, and then you tried to save her, Dr. Bob. Well, I went into to talk to the family, and the first thing I learned, folks, is that her dad, now 74, had coronary bypass surgery in his 50s. And maybe you want to take it from there, since it was tragic.
It was tragic. I'll remember her to the day I die. It was shortly after I joined you. And she was not the poster child for coronary disease. She was thin, she was active, but she was having symptoms, and she had for several days, and she came in far too late. We did everything we could. As you said, you put the circulation pump in. I did the angiogram. We got her I think I've sent maybe 2 or 3 people straight from the cath lab table to the operating room. She was one of those that went straight to the operating room.
That didn't work.
It didn't work. She got bypassed. She got re-bypassed. She got
assist device like Dick Cheney,
an artificial heart, and ultimately she passed away.
Yeah.
She died.
Well, the case in point from this is she never asked herself, could my dad's history affect me? Once she had the symptoms, she never considered it to be serious. And take this home, people. If you're waiting for an elephant to come sit on your chest, you keep on waiting until they're digging the proverbial hole. We have a caller. Carol from Tom's River. You have a story?
I do, Dr. Scott. First, I want to say I love the show. I'm learning a lot. And I just, at 32, I had a heart attack. And when I presented into the emergency room, all my pain was in my back, and I was very nauseous. And I was told by the doctor that I was too young for heart disease and that I was probably either sleeping wrong or my couch at home was either throwing out my back. The following day, I went to a different hospital, and the doctor fortunately admitted me because he said my blood pressure was off. And it was at that night when I was admitted that I actually had the heart attack. My question is also, how come your cardiac enzymes aren't elevated prior to you actually having the cardiac event, and it's only afterwards that your enzymes are really high and they can tell you that you had a heart attack?
Well, it's funny. Actually, Carol, you ask a great question, and we're going to have a pop quiz going into the break that's going to answer that question. It's all about the fact that it doesn't show up initially, and when you start getting some stuttering symptoms, exactly how many days between the first hospital and where you finally went in? Was it just one day?
It was one day later that I went to the second hospital because I was in extreme pain, and it was all in my back. I didn't have the so-called chest pains, but I was very nauseous and I was vomiting, and the pain was in my back.
Yeah, well, I mean, again, we're going to actually have a pop quiz about going into the second break, all about the differences between men and women and their symptoms. So you're bringing up all this of the issues that we deal with every single day. Going back to our previous case, the dizziness wasn't dizziness. It wasn't an ear infection. It wasn't anything. It was basically she was having mini cardiac arrests and having decreased blood flow from those, from a malignant rhythm. She had a full cardiac arrest on the basketball court, kind of came to and spontaneously was resuscitated, no CPR or anything like that. And again, you had the insight, Carol, to go to the hospital the first time that you had it, even at 32. You said something's, and I'm going to say this again at the end on our third point, is something's just not quite right, and that's you bring up that point. So it's good to even discuss now. We need to always pay attention to the details. As we said in one of our points, you need to recognize the symptoms. You recognized it. Another astute doctor recognized it the second time. And the bottom line is that the enzymes do not get elevated until 6 to 8 hours after the event. Once you've got that clot in the artery, and we'll talk a little bit about this after the break, that once it gets clogged and once damaged, once lack of oxygen and once lack of blood flow it forms a scar in the heart, we then pick that up by the enzymes in the blood. One general muscle enzyme and one specific enzyme. The general is called CPK and the specific one is called a troponin I. But Carol, I'm glad that you got diagnosed. I'm glad that you got taken care of. And obviously, how old are you now, can I ask?
I'm 44.
So you're 44. So no further problems after that?
Well, I've had stents over the years put in.
Okay, but no further heart attack.
no further heart attack thanks to you.
And you follow up regularly.
I do.
And you do what's told to you.
And I just want to say, I wish you were here when my mother was alive. I lost my mother at 50, and same thing with her. She was sick one day. We took her to the hospital 3 times in one day, and they kept diagnosing her as pneumonia, sending her home. And on the third trip back, it turned out she needed a pacemaker, and she passed away.
I'm going to interrupt you a second. Thank you so much for calling, Carol.
Thanks.
Pop quiz number 1 to break. Which blockages in your coronary arteries, 20%, 50%, or 80%, can be more fatal
More Dr. Scott and
cause
Smarter
more
Heart
heart
University
attacks?
is on the way on AM 9.